Sleep is one of the most powerful tools for restoring energy, maintaining mental clarity, and improving overall well-being. Yet, as we age, getting a good night's rest can become more challenging. If you have ever found yourself lying awake at night, waking up too often, or feeling tired even after spending hours in bed, you are not alone. Sleep patterns naturally change with age, but that does not mean quality rest is out of reach. Experts from Age UK and HelpGuide have studied how aging affects sleep and what simple changes can make a real difference. In this video, we will explore practical, science-backed strategies to help you fall asleep faster, stay asleep longer, and wake up feeling refreshed. Small adjustments to your routine, sleep environment, and daily habits can have a huge impact on the way you sleep and recover energy each day. Welcome to AgeWise, where we bring you insights to help you live healthier, stronger, and more energized. Let's dive into the best ways to improve sleep and wake up feeling truly rested. Understanding sleep changes with age. As the years pass, sleep often does not feel as deep or restorative as it once did. Many people find themselves waking up more frequently, struggling to fall back asleep, or feeling groggy even after a full night in bed. While it may seem like a personal struggle, these changes are actually part of a natural shift in the body's sleep patterns. Experts from Age UK explain that as we age, the body produces less melatonin, the hormone responsible for regulating sleep. With lower melatonin levels, it becomes harder to fall asleep and stay asleep through the night. This leads to more fragmented sleep, where small disturbances can cause frequent awakenings, making it difficult to reach the deeper, more restorative stages of rest. HelpGuide adds that the body's circadian rhythm, which controls when we feel alert or drowsy, also shifts with age. This change often causes older adults to feel tired earlier in the evening and wake up earlier in the morning, even if they have not had enough rest. While this adjustment is completely natural, it can be frustrating for those who were once used to sleeping through the night without issue. On top of these biological changes, other factors such as chronic pain, medications, and increased sensitivity to noise or temperature fluctuations can further interrupt sleep. Many older adults also experience an increased need to use the bathroom at night, which can make it even harder to get continuous, restful sleep. Despite these challenges, poor sleep is not something that has to be accepted as part of aging. While the body may naturally experience lighter and shorter sleep cycles, there are ways to improve the quality of rest and restore energy each night. The key is to understand these changes and work with them rather than against them. By making simple adjustments to daily routines, sleep environments, and lifestyle habits, it is possible to get better sleep, wake up feeling more refreshed, and maintain strong energy levels throughout the day. The first and most important step in improving sleep is to establish a consistent sleep schedule. By setting a routine that aligns with the body's natural rhythms, it becomes much easier to fall asleep and stay asleep without disruptions. Let's explore how this simple habit can make a significant difference. Establishing a consistent sleep schedule. One of the most effective ways to improve sleep quality is to establish a consistent sleep schedule. Experts from Age UK emphasize that going to bed and waking up at the same time every day helps regulate the body's internal clock, also known as the circadian rhythm. This natural cycle influences when we feel awake and when we feel sleepy, and keeping it steady allows the body to develop a predictable rhythm that promotes deeper and more restful sleep. HelpGuide explains that irregular sleep schedules, such as staying up late one night and going to bed early the next, can confuse the body's internal clock. This inconsistency makes it harder to fall asleep at night and wake up feeling refreshed in the morning. Many people believe they can catch up on lost sleep by sleeping in on certain days, but research shows that this often leads to more fatigue rather than restoring energy. The body functions best when sleep patterns remain stable, even on weekends or days off. Another key aspect of setting a sleep schedule is paying attention to natural sleep cues. Experts suggest going to bed only when feeling truly sleepy, rather than forcing sleep too early. Lying awake in bed for long periods while trying to fall asleep can create frustration and anxiety, which makes it even harder to relax. If sleep does not come within 20 minutes, It is better to get up, engage in a calming activity, and try again when drowsiness naturally returns. In addition to maintaining a regular bedtime, it is equally important to wake up at the same time each morning. While it may be tempting to stay in bed longer after a restless night, doing so can disrupt the body's rhythm and make it even harder to fall asleep the next night. Setting an alarm and getting out of bed at the same time every day helps reinforce a stable sleep-wake cycle. Over time, this consistency makes falling asleep feel effortless and waking up more refreshing. Light exposure plays a crucial role in regulating the sleep schedule as well. Natural sunlight in the morning helps signal the brain that it is time to be awake, which strengthens the body's internal clock and makes it easier to fall asleep at night. Spending time outside in natural light during the day or opening curtains first thing in the morning can help reinforce this rhythm. In contrast, exposure to artificial light from screens in the evening can delay the release of melatonin, making it harder to wind down for sleep. Limiting screen time and dimming indoor lights in the hours leading up to bedtime supports a smoother transition into restful sleep. A consistent sleep schedule is one of the simplest yet most powerful ways to improve sleep quality and restore energy. By keeping bedtime and wake-up time steady, following natural sleep cues, and regulating light exposure, the body learns to settle into a healthy and predictable rhythm. With this foundation in place, the next step is to develop a relaxing bedtime routine that helps prepare the body and mind for restful sleep. Creating a relaxing bedtime routine. Establishing a sleep schedule is essential, but preparing the body and mind for rest is just as important. A relaxing bedtime routine signals to the brain that it is time to wind down, making it easier to fall asleep naturally. Experts from Age UK emphasize that engaging in calming activities before bed helps reduce stress and anxiety, which are two of the most common causes of sleep disturbances. HelpGuide explains that stress triggers the release of cortisol, a hormone that keeps the body alert. When cortisol levels remain high in the evening, falling asleep becomes difficult. To counteract this, creating a consistent pre-sleep routine helps shift the body into a state of relaxation. The key is to choose activities that promote calmness rather than stimulation. One of the most effective ways to unwind is through reading a book. Unlike watching television or scrolling through a phone, reading does not expose the eyes to blue light, which can interfere with melatonin production. A physical book or an e-reader with a warm-toned display allows the mind to focus on something soothing while reducing tension from the day. However, it is important to choose reading material carefully. Avoid books that are too intense, suspenseful, or thought-provoking, as they may increase alertness rather than relaxation. Another proven method for promoting relaxation is taking a warm bath or shower before bed. Age UK highlights that body temperature naturally drops before sleep, signaling the body to enter rest mode. A warm bath or shower raises body temperature temporarily, and as it cools down afterward, the body recognizes this shift as a cue for sleep. This small adjustment can help people fall asleep faster and experience more restful sleep throughout the night. Listening to soothing music or calming sounds is another effective way to relax. Studies show that slow, gentle music helps lower heart rate and blood pressure, easing the transition into sleep. Many people also find comfort in listening to nature sounds such as rain, ocean waves, or gentle wind, which create a peaceful atmosphere that drowns out background noise. HelpGuide suggests experimenting with different types of sounds to find what works best. Gentle stretching or deep breathing exercises can also prepare the body for sleep. Simple movements help release physical tension, while controlled breathing activates the parasympathetic nervous system, which promotes relaxation. Progressive muscle relaxation, where different muscle groups are tensed and then released, is another effective technique. This practice helps calm both the body and the mind, making it easier to drift into sleep naturally. A crucial part of a successful bedtime routine is avoiding stimulating activities before bed. Age UK advises against watching intense television shows, engaging in heated conversations, or working on stressful tasks late at night. These activities keep the brain active, making it harder to transition into sleep mode. Instead, dimming the lights, keeping noise levels low, and limiting screen time at least an hour before bed can help create an ideal sleep-friendly environment. The goal of a bedtime routine is not just to pass the time before sleep, but to train the brain to associate certain activities with rest. By consistently following a calming pre-sleep routine, the body learns to recognize these signals, making it easier to fall asleep naturally and wake up feeling refreshed. Once the bedtime routine is established, the next step is to ensure that the sleep environment itself supports deep and uninterrupted rest. Let's explore how small changes to the bedroom can make a significant difference in sleep quality. Optimizing your sleep environment. A restful night's sleep does not just depend on habits and routines. The environment in which you sleep plays a crucial role in determining how well you rest. Experts from Age UK emphasize that the bedroom should be designed for comfort, relaxation, and minimal disturbances to promote deeper and more restorative sleep. Small adjustments to lighting, temperature, and noise levels can make a significant difference in sleep quality. HelpGuide explains that darkness is essential for producing melatonin, the hormone that signals to the body that it is time to sleep. Even small amounts of light, such as street lights outside the window or electronic device screens, can interfere with this process. To create the best sleep environment, it is recommended to use blackout curtains or an eye mask to block unwanted light. Dimming the lights an hour before bedtime also helps signal to the brain that sleep is approaching. Temperature control is another key factor. The body naturally cools down during sleep, and a room that is too warm can cause discomfort and frequent awakenings. Experts suggest keeping the bedroom between 60 and 67 degrees Fahrenheit for optimal sleep quality. Using breathable bedding, such as cotton sheets and lightweight blankets, can help regulate body temperature. If the room feels too cold, layering blankets instead of raising the thermostat allows for better control over comfort. Noise levels also impact sleep quality. Some people need complete silence to rest, while others find that white noise or gentle nature sounds help block out disruptive noises from outside. If sudden sounds frequently disturb sleep, using a white noise machine, a fan, or earplugs can help create a more consistent and calming atmosphere. HelpGuide highlights that low, steady sounds, such as rain or soft instrumental music, can relax the mind and improve sleep depth. Another important aspect of a good sleep environment is the quality of the mattress and pillows. Age UK advises that a mattress should provide adequate support for the spine while still being comfortable. An old or sagging mattress can lead to poor sleep posture, which may cause aches and pains in the morning. Replacing a mattress every 7 to 10 years and using pillows that properly support the head and neck can prevent unnecessary discomfort. Memory foam or orthopedic pillows are particularly beneficial for reducing pressure points and improving spinal alignment. Reducing clutter in the bedroom can also improve sleep. A crowded or messy space can create stress and make it harder to relax. Keeping the bedroom tidy, using soft, calming colors, and removing unnecessary distractions can transform it into a peaceful retreat. The bedroom should be associated only with sleep and relaxation. Using it for work, watching television, or engaging in stimulating activities can weaken the brain's association between the space and rest. Technology use in the bedroom should also be minimized. The blue light emitted by screens, such as phones, tablets, and televisions, suppresses melatonin production and makes it harder to fall asleep. HelpGuide recommends avoiding screens at least 1 hour before bed and keeping devices out of reach to prevent the temptation of late-night scrolling. If using a phone as an alarm, enabling night mode, or turning on a blue light filter can reduce its impact on sleep quality. A well-optimized sleep environment makes it easier to fall asleep and stay asleep throughout the night. By controlling light exposure, maintaining a cool temperature, reducing noise disturbances, and investing in a comfortable mattress and pillows, the body can fully relax and recover energy more effectively. Once the sleep environment is set up for success, the next important step is making mindful choices about food, drink, and physical activity to further support deep and restful sleep. Let's explore how daily habits can either help or hinder sleep quality. Being mindful of food, drink, and daily habits, what we eat and drink throughout the day, has a direct impact on how well we sleep at night. Experts from Age UK emphasize that certain foods and beverages can either promote restful sleep or disrupt it. making it harder to fall and stay asleep. Being mindful of what and when we consume certain substances is a crucial step in improving sleep quality and restoring energy levels. HelpGuide explains that caffeine and alcohol are two of the biggest culprits when it comes to sleep disturbances. Caffeine, found in coffee, tea, chocolate, and many sodas, is a stimulant that stays in the system for hours. Even if consumed in the afternoon, caffeine can make it harder to fall asleep at night. Experts recommend avoiding caffeine at least 6 hours before bedtime to prevent it from interfering with sleep. Alcohol, despite its reputation for making people feel sleepy, actually disrupts sleep patterns. While it may help with falling asleep faster, it prevents the body from reaching the deeper, more restorative stages of sleep. This can lead to waking up frequently during the night and feeling unrested in the morning. Cutting back on alcohol consumption, especially in the evening, can lead to more consistent and refreshing sleep. Large or heavy meals close to bedtime can also make it harder to sleep. Age UK advises avoiding big dinners or late-night snacks that are high in fat, sugar, or spice, as they can cause discomfort, acid reflux, or indigestion. If hunger strikes before bed, lighter options such as a banana, a handful of almonds, or a small bowl of oatmeal can provide nourishment without disrupting sleep. Foods rich in magnesium and tryptophan, such as nuts, seeds, and dairy, can naturally promote relaxation and better sleep. Hydration is equally important, but timing matters. Drinking too much fluid before bed can lead to frequent trips to the bathroom during the night, which interrupts sleep cycles. Experts recommend staying hydrated throughout the day but reducing fluid intake in the evening to minimize nighttime awakenings. Physical activity plays a significant role in sleep quality as well. According to HelpGuide, regular exercise helps regulate the body's circadian rhythm and promotes deeper sleep. Engaging in moderate physical activity, such as walking, swimming, or yoga, at least 30 minutes a day can lead to more restful nights. However, exercising too close to bedtime can have the opposite effect. Intense workouts raise body temperature and increase alertness, making it harder to wind down. For best results, it is recommended to schedule exercise earlier in the day, or at least a few hours before bed. Exposure to natural sunlight during the day also supports healthy sleep patterns. Age UK highlights that getting at least 30 minutes of daylight exposure, particularly in the morning, helps regulate the body's internal clock and reinforces a strong sleep-wake cycle. This is especially important for older adults, as spending more time indoors can disrupt natural sleep signals. If outdoor exposure is limited, sitting near a bright window or using a light therapy lamp can help maintain a balanced circadian rhythm. By making mindful choices about food, drink, and physical activity, the body is better prepared for restful sleep. Small adjustments, such as avoiding caffeine in the afternoon, eating lighter meals before bed, staying hydrated at the right times, and incorporating regular movement into the day, can have a significant impact on overall sleep quality. The next important step in improving sleep is managing stress and anxiety, two of the most common barriers to deep and restorative rest. Let's explore simple yet effective ways to calm the mind and prepare for peaceful sleep. Managing stress and anxiety for better sleep. One of the biggest obstacles to deep and restful sleep is an overactive mind. Stress, worry, and anxiety can make it difficult to relax, leaving the brain in a state of alertness when it should be winding down. Experts from Age UK explain that chronic stress leads to the release of cortisol, a hormone that keeps the body in a heightened state of awareness. When cortisol levels remain high in the evening, falling asleep becomes much harder. HelpGuide highlights that anxiety about sleep itself can create a cycle of restlessness. Many people lie awake, frustrated that they cannot fall asleep, which only increases tension and makes the problem worse. Breaking this cycle requires strategies that help calm both the mind and the body before bed. One of the most effective ways to reduce stress is through relaxation techniques. Deep breathing exercises, progressive muscle relaxation, and mindfulness meditation have all been shown to lower stress levels and prepare the body for sleep. A simple deep breathing exercise involves inhaling slowly through the nose for 4 seconds, holding the breath for 7 seconds, and exhaling through the mouth for 8 seconds. This practice slows the heart rate, signals to the brain that it is safe to relax, and helps the body transition into sleep mode. Progressive muscle relaxation is another useful technique. This involves tensing and then slowly releasing each muscle group in the body, starting from the feet and moving up to the head. This method not only reduces physical tension, but also shifts mental focus away from racing thoughts, creating a sense of calm. Mindfulness meditation has been widely studied for its impact on sleep quality. Age UK recommends spending a few minutes before bed practicing mindfulness, which involves focusing on the present moment without judgment. Simply sitting quietly, paying attention to the breath, and gently letting go of thoughts that arise can significantly reduce nighttime anxiety. Guided meditation apps or calming audio tracks can also help make this practice easier. Writing down worries or thoughts in a journal before bed can also be an effective way to clear the mind. HelpGuide suggests keeping a small notebook by the bedside to jot down any lingering concerns. This simple act of transferring thoughts onto paper helps signal to the brain that it does not need to keep processing them throughout the night. Creating a short gratitude list can also shift focus from worries to positive reflections, promoting a more peaceful mindset before sleep. Limiting exposure to negative news, work stress, or emotionally charged discussions in the evening is another important habit. Age UK advises setting boundaries by avoiding stressful conversations or mentally demanding tasks at least an hour before bed. Instead, engaging in light, enjoyable activities such as listening to calming music, doing gentle stretches, or reading a relaxing book can help create a peaceful transition into sleep. Another key element in managing stress for better sleep is maintaining a strong social support system. HelpGuide notes that feeling connected to others reduces feelings of loneliness and anxiety, both of which can interfere with sleep. Whether it is having regular conversations with family and friends, joining a community group, or simply spending time with loved ones, social interactions can provide emotional reassurance that helps the mind relax. By incorporating stress management techniques into a nightly routine, the body and mind can gradually learn to let go of tension, making it easier to fall asleep naturally. Deep breathing, muscle relaxation, mindfulness, journaling, and setting emotional boundaries all contribute to a more restful state before bed. However, if sleep problems persist despite making these changes, it may be time to seek guidance from a healthcare professional. Let's explore when it is necessary to get medical support and what options are available for those struggling with long-term sleep issues. When to seek medical advice for sleep issues. For many people, improving sleep habits and managing stress can significantly enhance sleep quality. However, there are cases where persistent sleep problems may indicate an underlying health issue that requires medical attention. Experts from Age UK emphasize that chronic sleep disturbances should not be ignored, as poor sleep can have long-term effects on overall health, including weakened immune function, increased risk of heart disease, and impaired cognitive function. HelpGuide explains that sleep disorders become more common with age, and some conditions may require medical evaluation and treatment. If sleep difficulties persist for weeks despite making lifestyle adjustments, or if they begin to interfere with daily life, it is important to consult a healthcare professional. Struggling to fall asleep or stay asleep consistently may be a sign of insomnia that requires intervention. While occasional sleepless nights are normal, ongoing issues that occur multiple times per week for several weeks should not be dismissed. Experiencing excessive daytime sleepiness despite getting a full night's rest can also be a warning sign. Feeling drowsy or fatigued throughout the day may indicate an underlying sleep disorder, such as sleep apnea or restless leg syndrome. If loud snoring is accompanied by pauses in breathing or gasping for air, sleep apnea could be disrupting sleep cycles without the person even realizing it. This condition leads to fragmented sleep, poor oxygen intake, and an increased risk of heart problems, making early diagnosis and treatment crucial. Restless leg syndrome is another common sleep disorder that can severely impact rest. This condition causes an uncontrollable urge to move the legs, often worsening at night and preventing the body from fully relaxing. People dealing with this sensation may find it difficult to stay still long enough to fall asleep, leading to chronic fatigue. Another indicator that medical guidance is necessary is the regular reliance on sleep medications. While occasional use of sleep aids can help in certain situations, consistent dependence on medication may signal a deeper issue that needs to be addressed. Long-term use of sleep aids can lead to dependency and may mask underlying health problems rather than resolving them. A doctor can help determine whether behavioral adjustments, therapy, or alternative treatments are better long-term solutions. Some people experience sudden behavior changes during sleep, such as acting out dreams, talking loudly, or sleepwalking. These symptoms could be linked to REM sleep behavior disorder, which may require professional evaluation to prevent potential risks or injuries. When consulting a healthcare provider about sleep issues, the process usually begins with a discussion of sleep habits, lifestyle factors, and any ongoing health conditions. Keeping a sleep diary in the weeks leading up to the appointment can help identify patterns and triggers that may be contributing to poor sleep. In some cases, the doctor may recommend a sleep study, which involves monitoring sleep patterns, breathing, heart rate, and movement throughout the night. This type of test can diagnose conditions such as sleep apnea or periodic limb movement disorder and provide insight into why sleep quality is suffering. For those dealing with chronic insomnia, cognitive behavioral therapy for insomnia is often recommended as an effective treatment. This approach focuses on identifying and changing negative thoughts and behaviors around sleep, helping people develop healthier sleep patterns without relying on medication. In some cases, underlying medical conditions such as arthritis, acid reflux, depression, or hormonal imbalances may be interfering with sleep. Treating these conditions directly can lead to natural improvements in sleep quality without the need for direct sleep interventions. Getting the right medical support when needed can be a game changer in restoring sleep and improving overall well-being. While lifestyle adjustments can make a significant difference, persistent sleep disturbances should never be ignored. Addressing sleep issues early can prevent further complications and lead to better energy levels, improved mood, and a stronger, healthier body. With everything covered, the most important question remains: how can all of these strategies come together to create a long-term plan for better sleep and lasting energy? Let's bring everything full circle.